Afternoon, all of you. Good morning, Kevin Christian. Yeah, we are very indeed a pleasure to have you at this junction. You have accepted our invitation. It is our fortune. In this today's session, I would like to introduce the speaker of the day, Mr. Kevin Christian, who is very hardworking in nature, pessimistic personality, and spiritually strong. And he has been dedicated towards the education since the beginning of his schooling, and he has shown his competency during his period of workings areas, as well as he achieved height even being here in India, and thereafter he reached to abroad. He completed his master degree in Symbiosis International University, Pune in the year 2013. And before that, he completed post-basic BSc Nursing, and before it, Diploma in General Nursing and Midwifery. He also continued his education in after reaching to UK, that is post-certificate in academic practice. He pursued in University of Hull, UK. And he has various experience in a different cadre as a staff nurse, nursing tutor, GFATM coordinator, assistant professor and HOD, assistant nursing superintendent in hospital, registered nurse in James Paget University Hospital NHS Trust, and presently he is working as a lecturer in nursing and other healthcare programs, University of Hull. He is also a certified ACLS and BLS instructor by American Heart Association and GFATM trainer under Indian Nursing Council. He has 32 publications in various national and international journals. He has received awards from reputed Symbiosis International University and also from his schoolings. I welcome Mr. Kevin Christian for elaborative session. And this session speaks about the information about the prospects in overseas nursing, discuss future challenges in the delivery of nurse education, reveal opportunity to overcome the challenges in delivery of a future nursing educator. So now let us hear much more from Mr. Kevin. Over to you, Kevin.
Yeah, thank you, sir. I hope you are able to view this PowerPoint.
Yes.
Yeah. Respected Dr. Ravindra H.N. sir, organizers of Parul University and staff members and dear nursing students. It's been a great privilege to be a part of this webinar. And I also thank Dr. Ravindra sir for using some kind words to introduce myself. So thank you all once again. So let us begin. The topic that has been given is global opportunities in nursing. And I'll start with the objectives of this session. I've been told to, provide some information about prospects in nursing overseas, as well as, so that will be basically for all the nursing students who wish to, develop their career progression abroad. And if there are some nursing teachers, say, for example, clinical instructors or, assistant professors or any other teachers, nurse teachers who wish to know about the future trends and challenges in the delivery of nursing education and to know some of the opportunities to overcome such challenges in the delivery of future nursing education, then I'll be speaking about that too. So you can consider that this session is divided into two parts. First is for the prospects in the nursing overseas, especially for the nursing students. And there could be some aspirants who wish to, make their career progression abroad. And the second part would be for facing or viewing some trends and challenges in nursing education. So first, let us focus on some of the information about prospects in nursing overseas. So I'll be talking to all the nursing students and the aspirants who wish to make their progression abroad. So it's very much important to, make your goal first. So you can make your goal as far as nursing profession is concerned. You can make your goal in these three different aspects. Now, I don't say there are only three aspects. There could be many other, or it depends on how you look at your goal. But if you are in a nursing profession, and if you want to make your goal, if you want to progress your career, I see there are three different aspects. One among them is clinical career progression, where your client will be patient. The next is in the teaching setting, where your client will be a student, or in the public setting, where or in the community setting, where your client will be, public, general public. So you need to decide how your skills are, so that you can be supportive to such type of clients. So you need to decide whether you will be serving patients, or you will be serving students, or you will serve a general public. And according to your skills that you have, and according to your interest, you can make your goal. Now, if you develop such career progression, or if you think, or if you start making your goal, there are some skills that you need to develop. So say, for example, if you wish to focus on to be a clinical nurse, to be a good clinical nurse, your client will be patient. And if this is your goal, if you want to become a good clinical nurse, or you want to progress on that direction, what you need to develop is to develop your clinical skills, to understand clinical research, and very importantly, you should develop 6 C's in nursing. Now, this point, 6 C's, is very important. And it is so much important that any nursing profession, or any nursing personnel must have this 6 C's if they want to progress in nursing. Now, this is so much important that I'll explain this, what 6 C's are, or I'll show what 6 C's are in the coming slide. But I'll talk about the other skills that is required. If you wish to be a nurse teacher, or if you want to progress or make a career in teaching area, then apart from clinical skills and 6 C's, you should also have educational research, teaching skills, administrative skills, and management skills. So these skills are required if you wish to make a career progression in teaching area. So make sure when you are learning, when you are in a learning period, you grasp those skills, and you act accordingly. If you think that you are a good a public servant, or you are a good community nurse, you should, apart from all these skills, you should also focus on epidemiology, statistics, some of the decision making skills, analytical and evaluative skills. So these all skills are required if you want to progress accordingly as per your direction of goal. So it is very important to start thinking about your goal. What do you want to become? You might be first year nursing student or second year nursing student. I'm not sure about it. But start making your goal. Where do you want to progress? What do you want to become? So once you start making your goal, things will come, in that sense, if you focus on specific skills that I've mentioned. Yes, very importantly, as I've talked about, 6 C's. Now, I don't think I need to explain, because these words are so simple to understand. It is compassion, care, courage, communication, competence, and commitment. So this is from NHS England. And these 6 C's, these qualities are essential for any nursing personnel. So make sure when you are in clinicals or when you are in academic area, these 6 C's or these qualities, you try to develop those qualities. So a nurse has to be a compassionate, care, courage, communication, competence, commitment. So these are some of the important abilities and qualities that a nurse should have. So once you acquire those qualities, there is no reason that why you can't progress. So this is very important. 6 C's in nursing. So if you think that you want to make a career progression in the clinical aspects, so what opportunities are available overseas? So that's what, if you think about patient clinical setting, as far as United Kingdom is concerned, you can register yourself under adult nursing, child nursing, midwifery nursing, learning disabilities nursing, and mental health nursing. So think what is your interest, or what things motivate you, and do accordingly you can register yourself at overseas. And there are different positions according to your interest, like, say, for example, digital nurse, tissue viability nurse, nurse educator, enhanced recovery pathway nurse, prison nurse, respiratory nurse specialist, pain management nurse, district nurse. So these are different, positions that you may wish to, conquer according to your interest. So, say for example, digital nurse. So in this, if you think that technology motivates you, you can make your career progression in that aspects. Before that, of course, you should be a registered nurse in any of these elements that I've mentioned. But apart from it, you should also have technological ideas where you take the important objective data from the patient and you put that objective data in iPad or computer or any other technology that is available. So there are many other positions in this country that you could gain. So this is about clinical setting. So now, if you want to plan for overseas, what you can do. So you might be a student right now, and suppose maybe after 3 years, 4 years or 5 years, you wish to go abroad. So what currently you should do? So these are some of the points that you should focus as a nursing student. So very importantly, focus on English language. You start focusing it from today itself. If your plan is to go abroad, you should start reading newspapers, start reading your textbooks, talk with your friends in English language, and that's how you can progress or focus on English language. Once you complete your course, register yourself with State Nursing Council. So if you are in Gujarat, register yourself with Gujarat Nursing Council, but because that is a requirement. Even if you don't plan to go abroad, please register yourself with State Nursing Council. This is very important as far as registration is concerned. Make sure you keep your attendance clear, especially clinical attendance. So sometimes, you are not much worried about your attendance, and, you take holidays or you go to holidays, and you are not, sometimes some of the students are not much worried about attendance. But if your goal is to go abroad, make sure your attendance is clear, especially clinical attendance. So you should have good clinical hours as far as attendance is concerned. Learn clinical skills when posted in clinical. So you might be in the simulation center, simulation labs, or in clinical settings. So make sure you try to learn those clinical skills from your clinical instructor or any other senior nurse. So this is very important to develop your clinical skills. This will definitely help you while you become a registered nurse, maybe in India or abroad. Communicate with patient. This is so much important. Of course, this has to be in local language, Gujarati, Hindi, or whatsoever, but you should try to communicate with the patient. Now, as in communication, many of the students think that, it's only about talking, but it is not about only talking. It is also about listening. You can listen to your patient, what they say. You might feel that you are not competent enough to take care of them. No problem at all, because you are in the learning phase, but still stand with your patient and try to listen to their queries or concerns or worries. So this helps you to at least understand patient and to at least understand an individual at holistic point of view. So make sure when you go to clinicals, you communicate with the patient. If you are not able to speak up, or if you don't know what education or health education you need to provide to the patient, no problem at all, because you're in a learning phase. But at least try to listen to their issues, because that will help you to understand, what are the requirements of an individual, or how comprehensive nursing care can be provided. So that's why communicating with the patient, or even at least listening to the patient, is also important. As you know, the definition of communication, it is not only, sending messages, it is also receiving messages. So that means you should also listen to the patient. You should also, actively listen to your patient. So that is also very much essential. So if you focus on these points, I don't find any reason that you can't be abroad. You start focusing on these points, and you will definitely make your good portfolio, and that will definitely help you to go abroad and work as a registered nurse. And of course, make sure a record is satisfactory. Make sure our attendance is fine, and what are the other records are satisfactory. I'm telling you this because transcript is required. Every country will need to know how how many clinical hours have you spent in India. So that is very much essential. Transcript is required if you wish to come abroad. So these are some of the points, important points, that you should focus on if you are planning to come overseas. So that was all about nursing students. Now I've reached the part 2 of this webinar. So this is for all the nursing teachers who would wish to see what challenges would come in the coming days, and what opportunities we can develop, or how do we face those challenges in the delivery of future nurse education. So of course, even the students can listen to this, because it is very much essential. And if you plan to be a good nurse teacher in coming days, then definitely this will help you. So this is basically for nurse teachers. You may be a clinical instructor or any other cadre in nursing teaching profession. So when I talk about delivery of future nurse education, it is about the audiovisual aids that I use. And it is also about the teaching learning strategies, or the teaching learning methods that I use while I teach. And if I have to think about future nurse education, it is also very much essential to know what is happening right now and what has happened in the past. So let us see what has happened so far. So if you see in this slide, so far the enhancement, chalkboard was introduced in 1840s. Instructional school for nurses were developed in 1850. OHP was used in the year 1966. LCD projector were used in 1980s. Simulation were demonstrated in the year 1998. And from 1999, e-learning was developed. And since 2010 onwards, we are, teaching students, and we are using social online learning apps. We are using Zoom, Google Meet, and whatnot. And in the year 2020, we have started using many other, elements and applications to teach or to learn. So this is so far the enhancement that we have seen as far as delivery is concerned, as far as teaching learning strategies or methods are concerned. And if you see in all these elements that I have mentioned, there is only one thing which is common, and that is human being. It is human being who have invented, generated those learning strategies. Now, why am I focusing on this words human being? You will come to know at the end of the session. All right, so let us go ahead. So what are the challenges that we can, or that we are facing right now, or what challenges we will be facing in the future days? Rapidly changing technology. We were not aware of Zoom and any and other applications, but now in the year 2000, since 2020, we are using it, and we have to develop or adapt ourselves accordingly. So rapidly changing technology is one of the challenges that a nurse teacher or any other teacher could face in the coming days. Evidence-based teaching and practice. This is not a new challenge. This is already, ongoing challenge. And I remember my days when I was in India, I had to present a slide and I had to find a specific evidence behind it. So say, for example, if I'm teaching anything and if I say that this drug is useful in this case, then I have to find an evidence from, the evidence-based websites or journals or articles to prove that what am I teaching is not from the textbook, but it is also from the journals and articles. And definitely it is a challenge. You need to inform your students why you are using a specific teaching learning strategies. You need to inform your student, or at least show them an evidence that what you are teaching is on the basis of the evidence. And it is not simply coming from the textbook or from your heart. So that is one of the challenges that you would face in coming days. This is very much essential. Third point, that is functional affective domain. Now, we all know there are three domains as per the Bloom's taxonomy, that is cognitive domain, psychomotor domain, and affective domain. In cognitive domain, we talk about knowledge. In psychomotor domain, we talk about doing things or actions or psychomotor skills. And in affective domain, we talk about the attitude or the emotional areas. Now, I want you to understand this. What does functional affective domain means? So let us take an example. If you have bought this sports car and you are driving this car at the speed of 90 kilometer per hour, because it's a sports car and you like to drive fast. But then you see a sign that tells you that you should drive this car or you should drive on this road at the speed of 80 kilometer per hour. Would you still drive at 80? If you tell me, definitely I won't drive, because I like speed. So if I can break rule, I would definitely not follow this rule, and I would simply drive this car at the speed of 90. And I've done that. So that means I don't follow the rule. But if I see this camera in the crossroads, would I still drive at 90, or would I reduce my speed? Definitely, I would reduce my speed, because I don't want to penalize myself. Now, I am following the rule, because there are laws. I am following such rules because there are some restrictions, because I know that I will be penalized because of this, and that's the reason why I will follow the rules. But I am not following the rules, understanding the safety of myself, and understanding the safety of the car, and understanding the safety of the public who are nearby. So that is very much essential. So if I follow the rule, even if there is no rule, then I can, or then you can say that you are having a functional affective domain. So if you are a nursing student and if you are washing hands just because of the protocols of the hospital, or just because clinical instructor or your teacher or a senior nurse is watching you, then it is not okay. You should wash your hands once you understand that washing hands are important and it can save a lives of the patient by preventing infection. So if you understand that, then even if there is no such rule, you will still follow to do that practice. And once you do that, I would say that you are having a functional affective domain. And this is a big challenge for every nurse teacher to develop those skills in the students. So it's students sometimes follow only when somebody is watching them or observing them. But we should give that information and teaching in such a way that they follow even if nobody is watching them. So that is a big challenge that I see. Building competencies in a learner in upcoming healthcare situation. This could be one of the challenges. Transcultural nursing. It's very much important to understand the culture of patient as well as the co-workers to work in the environment. So transcultural nursing is also one of the challenges that we could face in the coming days, or we are facing presently. Comprehensive nursing curriculum. It's so much essential that we develop a curriculum in such a way that it includes all the aspects of the individual of an health. So making a comprehensive curriculum is also a challenge. Specialized teacher for specialized learning. We need a high-tech nurse who could, or we should have that specialized teacher for specialized learning. A nurse who could also take care of the clinical skills as well as the technological skills that is required to control digital equipment. So that is also one of the challenges that we face. Feeling human touch in online learning. Nowadays we know that everything is online, but it is very difficult to feel that human touch in online learning. So this is a challenge that I see in coming days. New hobbies, new disease. So we don't know. Our lifestyle is changing rapidly, and we don't know what disease we will see in the coming days. So when you find new hobbies in the patient or in any individual, you may find that there could be a new disease. And if such disease occurs, we never know how to treat that. And this could be a challenge for a nurse. Prediction in complex and diversified healthcare system. It is very difficult to predict what can happen next, because the healthcare system is complex and it diversifies at any time. So it's very difficult what can happen tomorrow. So that is one of the challenges that I see in the coming days. So what opportunities we have as a nurse teacher in the delivery of future nurse education? One of the opportunity that I see is high-tech, high-touch approach. We should learn the digital technology and we should develop that technology, or we should be in collaboration with that technology so that we reach to many people and we reach, or we develop our learning strategies, teaching learning strategies accordingly. Interprofessional education. It is also very important to, have that collaboration with other multidisciplinary team members or other, education sectors. Say, for example, working with a physiotherapist or working with a pharmacist. So we understand them. We should understand their syllabus, and we can have that interprofessional relationship with each other, and we can have a specific curriculum out of it. New teaching learning strategies. We can develop a new learning strategies, and we can face those challenges accordingly. Building leadership, collaboration, and teamwork. This is also very essential. We must build a leadership among ourselves, collaborate with other team members, and definitely teamwork is essential in implementing all such interventions. Last but not least, very important is mentoring and guiding. This is one of the oldest, aspects, but it still remains an opportunity. Whenever you find a student, mentoring and guiding will help them to overcome their problems. So this is an opportunity for us to talk with the students and to mentor them and to guide them in a specific direction, so that they come out of their issues and concerns. So this is what I see as some of the opportunities in the coming days. So I'm coming back to this previous slide where I've talked about some of the audiovisual aids, and I've talked that human being is one of the common aspect in the inventions or the discoveries, or developing something as teaching learning strategies. So I see that there is one big challenge in front of us as a nurse teacher, and I also see one big opportunity for us as a nurse teacher in facing that challenge. And there is one thing you can consider as a challenge as well as an opportunity, that is nothing but being human. This is so much essential, and it is very much close to my heart, that and it is very difficult as well, and that's why I tell this as a challenge. It is very much difficult to inculcate the human values or moral values in our students, and to teach them about care and compassion is something out of a teacher's hand or ability. So it is only the person himself or herself can understand that this is something valuable, and this is something that I need to do as a nurse or as a human being. So being human is one of the challenge that I see in inculcating the values of human being in the nursing student. And as well as this is also an opportunity for us as a nurse teacher to inculcate these values of being human in our students. If we inculcate one of the important value of human being into a nursing student, you never know, you would save hundreds and thousands of lives of patients or any individual. So we should take this opportunity to inculcate and to instill the values of being human in a nursing student. So that's why this I see as a challenge as well as an opportunity. And therefore, I say that it is not always possible to be correct, but it is the approach towards correctness that can make a change. Thank you so much for your patience listening.
Yeah, nice, Kevin. You have elaborately explained the various opportunities at overseas, global opportunities around us. You have covered up the most of the areas which are not given by the books, or not given by any person individually so far. So your explanation with the 6 C's were very good and very indeed necessary. Everyone to follow the same, and this is compassion, care, courage, communication, competency, commitments are the basic requirements as a student or as a teachers. If you want to achieve height, then these are very essential need. You have stressed on it. That is, I appreciate that. And the opportunities and also the requirements to go height. So all those things are also explained very well. So uh, it was covered up most of the areas what we expected. So there are few questions I received so far during this seminar as well as before the session starts.
Yes, please.
A question started like this: I'm working in private nursing college. Is there any chance to work, and how to get work at abroad? So I think after looking into the session, she or he must have received the information. What are the basic requirements and elements? So I don't think so. We need to much stress on the same. I think the spectator must have received the answer for this during the session. And the basic requirement is the GATE exams to go abroad. See, basic exams are IELTS or the competency-based examinations in the subject specialty. So, how to crack these, according to you?
Yeah. Thanks for the question. So if I have to talk about coming to UK, so there are 4 exams that you need to give. Starting from, as I've mentioned, focus on English language, you might have to give IELTS Academic as far as nursing registration is concerned. So as we have Gujarat Nursing Council, Indian Nursing Council in India, we have Nursing and Midwifery Council at UK. So the requirement is to crack IELTS Academic with 7 bands in reading, speaking, and listening, and 6.5 in writing. And I hope most of you are aware of this. Once you give this IELTS exam and you acquire the score, you can then plan to give CBT exam, that is computer-based test. So in this exam, they ask 120 MCQs, and you can book yourself at Pearson View Test. That is in, I think, Ahmedabad as well as in Surat if you are in Gujarat. And then you get 120 MCQs, and you might have to go through the professional values in nursing. You might have to go through the clinical skills, leadership management, and team making, and specific field competencies as far as adult nursing is concerned. And the questions are pertaining to CBTs. Multi MCQs. So that takes around 3 to 4 hours. I'm not sure, I've forgotten. But there are 120 MCQs that you need to crack. And if you are giving adult nursing exam, you have to score beyond 68%. So if you score beyond 68%, you have passed the exam. So if you work hard, and if you have the syllabus with you, and if you know what you need to study, definitely you can pass the exam. Once you pass the CBT exam within India, then once you get a job offer letter from UK, you can come to UK. Before coming to UK, there is one more requirement of the visa immigration center. And they say that you should have IELTS UKVI, that is a special English exam, just to provide it as a proof that you know English, even if you have passed IELTS Academic. And the requirement is just 4 bands, which is very easy to acquire. So that is IELTS UKVI that you need to give before you just reach to UK. Once you reach to UK, you have to give OSCE. OSCE. And in this OSCE exam, it's a practical examination, and you would get assessment, planning, implementation, evaluation, APIE. You would get scenarios, and you would also have to perform 2 clinical skills. That could be, removal of catheter, or it could be dressing, or it could be CPR to present. to demonstrate. So this is one of the examination that you can give. So there are totally 4 exams that you need to do: IELTS Academic, or else you can give OET, or next is CBT, third is IELTS UKVI, 4 bands, and the last one, when you reach here, you have to give OSCE. I hope I have answered the question.
Yeah, yes, you have explained very well. Thank you. And the next question is there any chance to choose or change the workplace once after reaching over there? So as you
Yeah,
you have entered to UK as a registered nurse and being there for a few months, then later you changed into education side, and there are many opportunities. Maybe please can you elaborate into that area?
sure, definitely. Uh, I'll divide this question into 2 parts. If you are a registered nurse, and if you come here as a registered nurse, you can still change your work area. If you think that you are not comfortable with the working area, you can still apply to another hospital as a staff nurse. But again, you might have some contract period. I'm not sure about it. You understand. You will come to know that once you get a job offer, and you might have to pay something to the trust if you want to get out of the contract. So that depends on your job offer later. So you can change a workplace from one place to another. That is possible. You can also leave the country and go back to India if you are not comfortable. So that is also possible. But it all depends on your choice and an interest. If you are thinking to move from hospital to the teaching side, that is possible, because it has been possible with me too. Even I was not sure that it is possible, but because I had an interest to participate in the interview session, I kept on applying to many of the universities in UK. And I was really not sure. There were many people who said that this is not possible. You might have to study from United Kingdom, or you might have to do some course if you want to go to teaching section or teaching area, or to the universities. But because I was much more optimistic, I simply applied to many of the universities. And you have to go to the interview session, and you might have to present something, and they might look at your CV. And I can say, because it is possible with me, definitely it could be possible with you all. But you need to have a master's degree. That's what I felt. And you need to also develop your teaching skills to, make them understand that you are capable of handling the students. And definitely, very importantly, you should be a registered nurse in UK. So if you are not registered nurse, there is highly chance that you won't get a job. So that means, first step, if you're thinking to develop your career abroad as a teaching, in the teaching area, you should be a registered nurse. So you can come to this country as a registered nurse, get those clinical skills, get some experience, understand the patients that are there in this country, understand how they work, how the multidisciplinary team works. And then after some experience, if you think that you should go for teaching, you should go at universities to teach, that is possible.
Thank you. You have touched the areas where you can able to choice and choose your appropriate area of your like once after being entered into the overseas also, you said. And also you have covered that the message to the students that what is most important is your record, your attendance, your communications, your working with the patient's experiences, and thereafter you said that it is to learn English and also about the competency. So that point I liked it, because this is a message for the students nowadays looks after a better job, but they do not wish to work hard. So that
Yes.
is the reason this message also includes that the dream starts from the first year itself of education itself. Then only they can able to achieve good, and by the end of their course, they can be come out with a very good student and with the good marks and also good caliber to go and reach abroad. So let me ask you one more question. So what
Yes,
are
please.
the working? How is the working atmosphere at overseas, and what are the challenges? Big challenges, climatic, societal challenges.
Oh, so if I'll first of all talk in the hospital area. So if you come here as a registered nurse, I'll tell you surely that you won't be comfortable in your some of the first weeks or first month or so, because you have to adjust with the environment. This is quite okay when it is summer. So the summer starts from around March till August, as far as UK is concerned. But that is really pleasant. So summer is really pleasant. Right now, there's a snow outside, just outside. So February is not a good month to come here. But of course, you have to settle in. If I talk about the clinical scenario or setting, you would see, of course, many of the developed countries face that there is nursing shortage. So you might have to work hard because there are definitely lack of human resource. So that could be one of the challenges that I see. There's a lack of human resource. That means an individual has to work more to accommodate other person. The other challenge that I see is a complex of skills that you need to develop, and you cannot work unless and until you have even if you know, or even if you have developed mastery over that skill, you cannot do that unless and until you have taken training within the trust. So you need to do do a training in that area, and then only you can implement or practice. So this is one of the challenges that I see. And yeah, the disease pattern is different. It could not be as much complicated as in India, but there are here there is it's more prone, like even if the blood pressure is 180 or 170, it's fine, and the criteria is different. You need to understand those news chart, national early warning signs score. So the pattern or some of the protocols are different that you need to adapt within. And so these are some of the challenges that I faced while working in clinical area.
Okay, what are the subspecialties in nursing at abroad? Is it similar to India, or is there any subspecialties much more?
Yes. I think, say for example, if you want to do BSc nursing in UK, so you can do it as an adult nursing, which is similar to medical surgical nursing in India. Then we have child nursing, which is there in India. We have mental health nursing. We have learning disabilities, special learning disabilities nursing, which I don't think it is there in India. And we have, so that's it.
All right.
And midwifery is there.
Okay.
So these are different specialities that you would see at United Kingdom.
Okay. What is the common salary package for the nurses?
Yes. Sure. It is around £24,000 per annum. So once you give all these examinations, you come here as a band 4 nurse. So as a band 4 nurse, you would earn around £22,000 per annum, which could be around 20 lakh per year or so, roughly. And once you give this OSCE exam and you become a registered nurse in registered nurse at UK, your salary will be at band 5, which starts from £24,000 per annum, which is around 22 lakh per year, in rupees. So that's the salary package here. And apart from this, yeah, let me tell you, if you come to UK, all of your expenses will be taken care by the NHS, that is National Health Service UK. So that means all your expense related to the examinations, IELTS, it will be taken care by the NHS United Kingdom, because there is so much shortage of nurses. You don't have to pay anything for examinations. You don't have to pay for your medical. Your medical. You don't have to pay for even your flight charges. Everything will be taken care by them, of including 2 months stay at United Kingdom. So or 2 months accommodation is free. So that is all other extra benefits that you get.
Yeah, one of the biggest university in India and topmost university of India, the Parle University, is also taking the responsibility and supporting the students to send abroad for various universities for the higher education under the international relationship cell. So they give the teaching coaching for IELTS, as well as give supports for higher education at abroad, various reputed universities at abroad. The neighbors or the students of the same university or related members can also take this opportunity at Parallel University. And I think we have covered most of the areas, and we have completed. You have explained to the questions which are arised from the audience and from my end. We are very much happy to you as a seminar, as a resource person today. There were a lot of interest and clarification questions raised since day before when we announced the webinar. So it was an indication that how good form followers you have. So that they wanted Mr. Kevin to watch in the webinar and in the web camera. So thank you, Kevin. Still achieve height and go ahead. And thanks once again for all the viewers and also to the research person for being with us and to for your patience listening. And once again, my wholehearted thanks to Mr. Kevin for conducting these sessions. Thank you once again.
It's a great privilege. Thank you so much for calling me, and it was really nice to present this topic to nursing students. And yeah, I'm really privileged. You're very much welcome. Thank you, sir.